So, uh, my name is Dave Fenner. I joined the Naturalist program in the fall, and I want to give a little bit of my background. I'm a pediatrician. I came to Poughkeepsie, which is in Dutchess County, in 1985. And when I arrived there was right about when Lyme disease was really starting to take off. And for about the next probably 10 or maybe 15 years, Dutchess County was one of the main epicenters of Lyme disease in the country. For a long time back in those days, we had about, let me make sure, hold on, my PowerPoint. Can I get it moving? Hold on. So we had as much as a third of all of the Lyme disease in New York State. And at times we heard that we had as much as 10% of all of it in the country. So we got a real head start on seeing Lyme disease. And so now, over 40 years of practicing in a highly endemic area and seeing many cases every year, I've seen several hundred cases of kids with Lyme disease and some with adults as well. Um, and so I've seen just about every manifestation that there is. And being a pediatrician, being on the front line, as opposed to being um, an infectious disease specialist or a researcher, I got to see the real how it affects the community directly, seeing the common cases as well as some of the uncommon cases. The reason that I told Christy that I'd like to give a talk to this group is kind of twofold. One is that I think just because of our interests, we're putting ourselves in the way of ticks. And for our own protection, really understanding tick-borne illnesses, I think is very worthwhile. And then the second thing is, I think that other people are going to be looking to us for a higher level of expertise than the average non-medical person, whether you're leading hikes or doing something like that. And so I want to take your understanding to something of a higher level. Um, First thing I want to do on the Naturalist Exchange, Joellen Lampman has posted just a tremendous video called "Don't Get Ticked." And if you haven't watched it, I would. If you haven't watched it recently, I would refresh your memory on that because she goes through a very, very good explanation of all things tick. So the second shout out that I want to give is to the Carey Institute of Ecosystem Studies. This is in Millbrook, which is in Dutchess County. And they have been studying ticks and Lyme disease and other tick-borne illnesses for over 30 years. And so much of our information that we know has come from there. Certainly what I've been able to use in my practice, a lot of it has come from there. And a lot of the information I'll be giving today has come from there as well. Also, I should say the New York State Department of the DEC has good information on it, and a lot of the epidemiology that I'll look at has come from there. I should also say the CDC, while we still have a CDC, was a source of some of the epidemiology as well. So I'm going to concentrate, rather than going through the entire list of all possible tick-borne illnesses, I want to do kind of a weighted approach. And what I mean by that is I want to concentrate on um, Lyme disease, number one. And if you look at the graph here, this is a national graph, but Lyme disease is the most common tick-borne illness in the country and certainly in New York State as well. Um, and in New York State, our second most common is anaplasmosis. This lists that along with ehrlichiosis, we have a little ehrlichiosis, but anaplasma is becoming a more important issue around here. And we don't see much Rocky Mountain spotted fever, but babesiosis is the third thing that I'll try to spend a little bit of time on if we do get to that. So what I want to talk about is kind of the tick biology, ecology, and then how they transmit diseases. From there, I'll take you into the medical world of the manifestation of diseases. I want to show you how we diagnose them, clear up some of the issues in terms of testing so that people can understand the limitations of testing and so forth, and then talk about prevention, of course. The key points that I hope everybody will come away with are going to be these. Most Lyme disease comes from the ticks you don't find. And you're going to see that statement pop up like, where's Waldo, again and again in this talk. And so it's one thing that I really want you to understand. You need to either prevent the bites or find the ticks as much as you can. Second thing, most Lyme disease comes from the black-legged tick nymphs. And we'll go through that in some detail, but that's one thing to really understand, that we're going to focus on the nymphs more than anything. Most Lyme disease is in May, June, and July. And I think you'll come away knowing that. And then prevention, early detection, and treatment are really the important things to prevent ourselves from getting significant problems. Whoops, I skipped one here. And this is from The Art of War. Know, know thine enemy. Know thy enemy and know thyself. In 100 battles, you will never be defeated. Um, so here we go. Let's know this. First, let's meet the ticks. All of the diseases that I'm going to talk about come from the black-legged tick, also known, the scientific name is Ixodes scapularis. It is commonly known as a deer tick. So most of the lay public will know it as that. I will be referring to it most of the time as deer ticks. I put this slide up so that you can see the other common ticks so that we can distinguish deer ticks from them. The other quite common tick is the dog tick. And before deer ticks really started to explode, 40 years ago or so, dog ticks were by far the most common ticks that anybody would get. You can see the differences if you look at the adult deer tick. Now, we always see pictures of the adult female deer tick, but it's kind of a reddish brown before it's fed. It's smaller than the dog tick. The dog tick has this big white on its back. The legs are much less prominent. It's a more delicate looking tick. We are starting to see some Lone Star ticks. And again, if you go to Joellen's Don't Get Ticked video, she'll give you a lot of discussion of that. But I wanted to put those up just so you can see the distinction. Now, I've said already, and I'm going to say it very many more times, most of the problems that we deal with come from the deer tick nymphs. And I want you to appreciate how tiny these guys are. So if you look at your own fingertip and you look at this, you'll realize that the deer tick nymph can fit within about 3 fingerprint lines. They're tiny. If you look up here into the right corner, I put this one up here. And when I did this for a high school group recently, I brought out a bunch of dimes to be able to look at this. If you look at the size of the deer tick nymph, it's smaller than the D on the back of a dime. They're tiny. So when I say know thine enemy, here's who we're dealing with. Let's take a closer look. We always describe adult deer ticks as being the size of a sesame seed, and here they are lined up. They are exactly the size of a sesame seed. The nymphs, the real problems are the size of a poppy seed. And again, here we have a bunch of them with poppy seeds. I wanted to get a picture of them on a bagel. I couldn't find one, but actually when I look at this, it looks like a bagel. So, but just to get a sense of the size of them. Now, I'm going to go back through a little bit of the tick biology, and that is that ticks go through 3 life stages. I guess 4 if you were to count the eggs. There's the larva, the nymph, and the adult. They're going to feed once in each of these life stages, and they can't go on to the next life stage unless they do feed. And so, so initially, so let's go through each of those. The larva is going to be the first stage. So the adult tick can lay up to 2,000 eggs. This is done in the spring, usually around mid-May or so. And then the larva, if you follow this little spirally thing, let me capture this. If we follow, oops, no, let's just go back. We'll get rid of that. If we follow this along, the eggs are laid in the spring and the nymphs come out in the summer and feed. If they've taken a blood meal, they will now overwinter. They'll go dormant over winter and emerge in the spring as the nymphs. And again, this is where the problem will be. The nymphs come out in mid-spring into the late spring and early summer, and try to take their blood meal. If they're successful, they're going to take off July and August and reemerge in the fall. And we look at this. These are the adult ticks that was the nymph molted to become the adult tick. And they come out in the fall. And I can tell you with my experience here, it's almost like you turn the calendar to the month of October and the ticks are everywhere. Um, those ticks are going to try to feed. They'll feed very vigorously uh, in October and November. And then if they've taken a blood meal, they'll be able to lay eggs in the spring. If they did not take a blood meal, they'll still feed during the winter and even again in the spring because they have to, a nymph has to, I mean, an adult tick has to take a blood meal in order to lay eggs. Now, oops, I'm jumping ahead on this. So again, the larval ticks are going to molt. I guess I skipped past it. The larval ticks will molt to become the adult ticks in the fall. The nymphs may harbor the pathogens if they picked it up during their larval feed, and they can pass that along. And again, the adult tick active in the fall, eggs in the spring. The males actually, the adult males don't feed. So where do we find them, or where do they find us? For the nymphs, they are mostly going to be found in leaf litter. Um, and the tick densities, so when you look at where ticks are going to be, they're going to be much higher in deciduous forests. Again, the leaf litter is going to be there. You'll see less of it in wetlands, less of it in coniferous forests. Oak trees tend to be, and oak forests tend to be a particular problem because the acorns are such good food for the mice that we're going to find are one of the real problems. Where do we find the adult ticks? We're going to find them in a little bit higher up. So adult ticks can be found as high as 3 feet off the ground, but typically they're going to be up to about 18 inches or so. And you can see them on, blade of grass like this. In the winter, they're going to overwinter in the leaf litter, as we see kind of down in the corner there. They're going to be dormant when it's very, very cold out. But as soon as it warms up even a little bit, we'll start to see them feed. And any warm day in the winter, I always had calls about tick bites. Now, one thing I'd also point out is that, we often say that 37 degrees tends to be a threshold. Just because your thermometer outside of your house says 37 degrees doesn't mean that where that tick lives is at that temperature. If the ground had still been warm, I'd still be cautious about the adult ticks. Now, where do we find them? The adult ticks literally hang out on the tip of, say, a blade of grass or some low brush. They hang out with their front legs kind of spread out like that, waiting for a proper host to come along. In their front legs, they have something called Haller's organ, and that senses carbon dioxide, heat, and it can detect odors. They're actually blind, so they're not watching for you. They're detecting you through these other things. We call this position questing, and then when the animal brushes by, it's going to attach to there. So where do we find them? One really important thing to note with the deer ticks is that they require moisture. Their biggest enemy is going to be desiccation. This isn't true for dog ticks, so you can often see dog ticks in a drier area. But the deer ticks are rarely going to be found out in an open mowed lawn that has a lot of sunshine on it, because they're going to get too dried out. And so, for me as a pediatrician, the kids aren't going to get tick bites when they're out playing soccer, but if they chase the ball into the woods, that's where they're going to be able to pick it up. As we move more toward the taller brush, we can start to see ticks in there, but it's really when you get into the forested areas that you're going to see the most of them. It said that they need 3 inches or so of ground cover in order to find them. One thing I'll look at it is like, where will you find a mouse? Because they're the ones distributing most of it. Forest fragmentation has become one of the major drivers of ticks and these diseases. And what is a fragmented forest? Our natural environment would have been one contiguous forest. And now with roads, developments, parking lots, we break it up into little, much smaller fragments. This illustration here, I don't know what town this is, but you could probably call it Lyme Central, because each of these little forests is just right for harboring the kinds of small mammals that will bring us Lyme disease. But they're not big enough to host a, so we've had a loss of biodiversity. The predators that would have fed on these will be in much smaller numbers, as well as just other hosts for the ticks to be able to feed on. So if you think of possums and raccoons and things like that, that won't be in those smaller forest fragments. So from the Carey Institute, this little graph on the right, I found to be very interesting. And just to explain it, it shows per meter squared, how many infected deer tick nymphs were there? And that compared to what is the size of the forest patch. And you see the smaller forests um, have many, many more infected nymphs. And as you get out into the larger, broader forest, hopefully with more biodiversity, you see many fewer ticks per meter squared. This also was a very interesting, I think, an interesting study, again, from the Carey Institute. And what this is looking at is over 4 separate years, they were doing it in consecutive years, but it missed out on the pandemic year. They studied um, six different neighborhoods in Dutchess County to see how many deer tick nymphs they would find. And you don't even need to look at the exact numbers. You just get the visual of these graphs to see that in a cultivated garden, very few, in an open lawn, very few. And that contrasts to forests. So within each of these neighborhoods, you would have had each of those kinds of environments. So again, to show that it's that fragmented forest that has it. We see different amounts of ticks on different years, and that actually is pretty common. If we get a chance to talk about oak trees and we may talk about the mast deer and the oak tree effect on Lyme disease. Additionally, in a lot of these fragmented forests, we now have so many invasive species. And some of these really can be such well, here we have the Japanese barberry that can shelter the mice very easily. Um, what is it about Japanese barberry? If anybody has ever tried to rip this stuff out, it's vicious. It has little tiny needles that penetrate my gloves. Once you can finally get down to the roots, it's almost impossible to get them out. But this is a beautiful shelter for the white-footed mouse. Because just as I don't want to go anywhere near it, neither would the other predators for the mouse. And so underneath the Japanese barberry, for example, the tick density is much greater. So feeding preferences, the larvae and the nymphs. Small mammals are what they're mainly feeding on. Think about them, they're in the leaf litter mostly. The white-footed mouse has become the number one, the biggest problem in terms of Lyme bacteria. And why is that? Well, in order for the tick to be able to pick up the bacteria, it has to be actively circulating in the host's blood. Um, and so the white-footed mouse, this happens, very, very often. And why is that? And I like to look at it this way. Nature has handed them kind of the approach of live fast and die young. So I think the mouse is going into it with the attitude that, look, I'm probably going to get eaten and it's probably going to happen pretty soon. How fast can I produce how many babies in order to pass my genes on to the next generation? And so they turn out to be little baby producing machines. So white-footed mouse can reach sexual maturity in less than 2 months. They'll gestate for about 3 weeks. They can be fertile immediately after delivery of that litter. I don't know if they deliver, but in my world, we call it delivering. Um, and typically, they're going to average 2 to 4 litters per year with about 5 offspring, but they can have more frequent litters and more offspring when food is abundant. And again, the mast years of oak trees has become an issue there, and maybe at the end we'll have time to discuss that. Adults, adult ticks prefer feeding on larger animals. Deer have become the number one host. And I don't know if it's because of our overabundance of deer or if they naturally would always have just preferred deer. Um, but think about it, the questing behavior that I talked about is usually done anywhere up to about 18 inches off the ground. And so it is going to be the larger animals that pick it up. Deer and humans are what are called a dead end host. Um, in other words, we can get Lyme disease or any other of these bacteria from the tick, but we won't give it back to them. And the reason there, like I said before, you have to have actively circulating bacteria in your system. So going back to the white-footed mouse, one of the things when I talk about them trying to produce as many babies as possible, they have devoted much more of their energy to reproduction. They devote very little energy to immunity. And so they don't worry about the bacteria that are circulating through their bloodstream. With the larger animals, ourselves and deer, that need to survive a long time in order to pass our genes along, we need a robust immune system. We spend a lot of energy on that immune system so that they won't be circulating in our blood. The other, the main role for the deer in this whole thing is they will travel farther than mice, and so they are going to distribute it. If they once those infected ticks drop off of that deer, lay their eggs, they can have traveled a considerable distance. And so I think this would spread it into new regions. I actually wonder if in an area like Dutchess County, which is totally saturated with Lyme bacteria, I wonder if the deer actually matter. The bacteria are everywhere as it is. So the attachment, and again in Joellen's slide, I think she has a very good little video of this. But when the tick embeds in the host, it has little barbs that are first going to hold it in place, and then it's going to secrete a cement. And you can see up in the upper right, that is an adult deer tick that has just embedded. Now, the embedding takes a long time. It can take even a day for it to fully embed, but you can see that the whole front end of the tick is now in there. It secretes a cement to hold it in, and then its saliva contains quite a few chemicals, but certain ones that are going to decrease pain and itch so that you're not going to be aware of the tick biting you. It also has anticoagulants that are going to keep the blood from clotting so that it can continue to flow, and vasodilators, things that will enlarge a blood vessel to get a better meal. As they feed, they start to engorge. And so we look at the nymphs up top, and starting again as a poppy seed, they're going to feed for about 3 or 4 days and get engorged. And while these pictures, depending on the size of the screen that you're looking at, may look very big, take a look at this where we're putting them against a ruler, and the engorged adult or the engorged nymph, fully engorged nymph, is maybe 1.5 millimeters wide. They're very hard to find. Now, the adult ticks want to feed for a little bit longer, up to about 7 days. And they're going to start as a sesame seed. They're going to get up here, maybe to the size, they'll pass through the apple seed and maybe up to a small blueberry. They're easier to find. So let's have ticks meet the humans. And where do we find our tick bites? Well, ticks want a warm, moist area. And so we may get them low down, but they're going to move north. Ticks have something called a negative geotropism, which means basically they want to go up. And so they're actually programmed to try to embed on their actual natural hosts around the head and the ears and the neck. Probably two factors there. One is the skin is thinner, and the other is it's harder for the animal to groom there. So they're programmed to go finding those kinds of areas, and they'll move up as they find warm, moist places. We'll find them under the underwear. The belly button, I have taken so many ticks out of people's belly buttons, and I've seen so many Lyme rashes just encircling the belly button. Under the waistband of clothes, we will often see them, and under the arm. You can get them in the open spaces of the front and the back, but not so much. But the thing to really pay attention to is up around the scalp. And very often we'll find them when they're moving up. Um, we'll see them behind the ear and then in the lower part of the scalp, right around the edges of the scalp. I often think, is this sort of that we are not their intended host? How did they get on this hairless beast? And they're going to keep moving and moving and moving until they can finally reach the promised land of your scalp. And so many of them will be up in that area. You can find them on any part of the body, and they can hitchhike in. So your pets can bring them in. If it hasn't attached to the pet, you could certainly have them come in. An important issue as we get down to this, and one thing I want you to really understand at the end of this is the seasonality of the tick bites and of the diseases we're talking about. So each of these, we've gone through this briefly, and I'm going to go into detail now. Each of the life stages has its own season. The larvae tends to be through the summer, the nymph very much in the spring, and the adult is mostly in the fall. So let's break this down. So the seasonal feeding of the larva, again, legs were laid in the spring, and and they will emerge in the summer. And you can see by this graph, it can be the entire summer. It really peaks kind of August, kind of late summer, but you can find the larvae all the way through. But since they haven't taken a blood meal yet, they have not picked up any bacteria. They're really not a particular threat to us. It's a good thing because they are, when I say that the nymphs are tiny, these things look like a fleck of dust. Here's the important one. It says that the seasonal feeding of nymphs. Um, the larva that took a blood meal is going to overwinter and molt and come out in the spring. And when we see them feed is May, June, and July. And this graph is in kind of blocks, but I can tell you this is a smooth bell curve. We see a little bit of them in early May, and then the end of May, a lot. And early July, we'll still see them. By the end of July, hardly any. And we have a gap period here in August and September. Now, I have occasionally had people report a nymph bite there, but not very many. Some years, some seasons, there will be a little bit of nymph feeding in the fall. But again, this is a May, June, and July peak. Seasonal feeding of adult ticks is, okay, the nymph fed in the spring. It molts to become the adult and comes out in October. And like I said before, and I think this graph really illustrates it, it's just like you turn the page to October and they're everywhere. They'll feed vigorously through October and November. And if they didn't take a blood meal, they will try to feed on a warm day in the winter and then coming back out again in the spring in March and April. Now, I'm very curious this year. Last fall, we had, I think, all the way across the state, a historic level of drought. We had, where we are, we had no rain at all from, I think, September 1st until almost November. And even then, we had very little. Ticks don't like that. And so their feeding behavior may not have been what it normally would have been. I'm very curious to see right now what's going to happen with adult ticks coming out in the spring. I have a feeling that they didn't take very many, that they didn't feed as successfully, and we'll see a lot of them feeding right now. So let's talk about the diseases now. Lyme disease is the most common tick-borne illness. And it's caused by a bacteria called Borrelia burgdorferi. This is a kind of a bacteria called a spirochete. And you can see by the by this picture where it gets its name. It is a spiral shaped thing. Um, it's transmitted through the saliva of the ticks, and it kind of corkscrews through the skin and into tissues. Once it eventually gets to the bloodstream, it will then be disseminated through to other parts of the body. Now, we can see there are so many different illustrations of this, but just a quick one here to see the spread of Lyme disease. This was a map in 1996. It was very much along the coast and up the Hudson Valley. Again, around that time, we had about a third of all of it in New York State. And if you look now, it has spread to all across New York State, down into Pennsylvania, up into New England, and a lot of it around the Great Lakes right now. This was from 2022. This is just total number of cases by county in New York State. And you can see that that Suffolk County on Long Island had the most, and Dutchess County had the second most. Now, Suffolk, it's almost all out. It's mostly out on the end of the island. And we see a lot of them there. Suffolk County also has a population of 1.5 million. Dutchess is about 300,000. But we can see that it's really popping up in other parts of the state as well. And I found this interesting from the DEC website. The risk of an infected tick encounter in 2024, the Finger Lakes actually had appeared to have the most. And I wonder how many of the ticks actually are going to be infected. It's a good estimate to say that about 25% of the nymphs and about half of the adults are going to be infected. That's going to vary by region and time, but I think that's a good thing to think of. I go into it from a medical perspective, assuming that every tick bite is infected. Now, here's another quick little look here for people in the rest of the state, and this is the percentage increase. Now, if you go from 10 to 20, you've increased by 100%. But still, you can see that as this is moving farther and farther across New York State. So I think all of us need to pay attention to this. Now, how do the ticks actually acquire the bacteria and give it to us? Let's take this circle again. The eggs are laid, hatch as a larva. The larva does not contain the bacteria, but when it takes its first feeding, and it's usually going to be on these small mammals or a bird, and you can see the little squiggly line in there is indicating that this is an infected mouse. The tick picks up the infection, the larva. It now becomes a nymph that contains the bacteria, and the bacteria lays dormant in the tick's gut. When the tick feeds on the second host, and its intention is to feed on these small mammals again, these bacteria start to replicate. It can now give Lyme disease to that host, or if the host had it, it can pick up more of it. Now, we're an accidental host right here. So if that tick had Lyme disease and now is going to feed on us, this is when we pick up Lyme disease. Then the adult tick now has fed twice. It has twice as much chance of having Lyme disease. This illustration only shows it feeding on deer, but we can be fed upon by them as well. Just looking at this, how does it transmit? The lower one here shows the tick actually feeding on, taking the blood meal with the bacteria coming up into there. But once the tick owns that bacteria, and this is the next feeding, when blood enters the gut, the bacteria starts to replicate. And the saliva, then bacteria will be secreted by the tick's saliva into the host. And here's the interesting thing to me about this, how much of this gets secreted into us. Our blood only contains about 40% of our blood is red blood cells by volume. The tick only wants our red blood cells. So it's going to be spending its time on us, drawing in blood, concentrating the red blood cells, and secreting back the serum, the liquidy parts of your blood. That has now been filled with the bacteria. And that's why the longer the tick stays on you, the more blood that it's drawn in, the more serum that is secreted back into you. Now, a fully engorged adult tick can contain about a half a milliliter of blood. It will have taken in many times that while it's gone through its feeding process. So I'm going to go back to this picture again because the transmission of Lyme disease to us can start as early as 36 to 48 hours. So how do they look at that point? Again, these little poppy seeds by 2 days have barely enlarged. I've always thought they go from a flat poppy seed to a round poppy seed. And by this stage, they're already transmitting Lyme disease to us. Same thing with the adult tick. If we look at the little sesame seed here, by 2 days, it's enlarged a little bit. One thing when I'm looking at this to determine has an adult tick been feeding and is it getting engorged is the change in color. So there's the change in the shape, change in the size, but as they lose that reddish brown color, becoming more brownish and then almost gray when they're filled. And this thing is filled with nothing but red blood cells here. So I want to talk about the seasonality of when we diagnose Lyme disease and how that stacks up with as we talked about, the feeding cycles of the ticks. So this is a national thing. When was Lyme disease? What months is Lyme disease diagnosed? And we see here that it's really June and July, tapering down into August and tapering away as we go toward the winter and through the winter. How does that line up with the feeding of the ticks? Well, it's obvious here that it's much more going to be in line with the nymphs. So let's break that down a little bit. So if we look at the feeding time of the nymphs, I said that it was May, June, and July. The diagnosis of Lyme disease is made in June, July, and August. So there's a lag period. This has just shifted slightly to the right, and that's the amount of time it takes for the infection to incubate and for it to come to medical attention. And I think that when we see some of these others that kind of taper off over into the later months, that's the ones that didn't get diagnosed at the initial time of the bite. When we look at this graph of when does Lyme disease get diagnosed compared to the adults, remember that the adult feeding period started in October and December, or October and November, and we actually see that this is falling off during that time period. So adult ticks don't give us very much Lyme disease. And why is that? It's because you're never going to miss them. They are big enough that by the time they're going through their entire feeding period, this is 7 days on you before it wants to drop off, and it's big by that time. So by finding and removing ticks, and this can show us we are doing a lot to prevent Lyme disease. So I'm going to come back to this statement again. Most Lyme disease is going to come from the ticks you don't find. You're going to find the adult ticks. What are the symptoms of Lyme disease? About 70 to 80% will develop the rash. And let's dig deeper into that. So early Lyme disease is basically a localized skin infection. What you see is the infection itself right here. I put up this other picture here just to show that people with darker skin, it can be very hard to see the rash. But this is a localized infection. If we treat it at that time, it's not a very big deal. We say it's 70 to 80%. I have a feeling that there's more than that, but we miss several of them. The rash kind of grows very slowly over several days. It's hardly bothers you at all. I've had a number of cases where if I'm doing a well child check and I remember when one teenage boy took off his shirt, just his entire back was one big bullseye, completely unaware of it. Importantly, only 25% who are diagnosed with Lyme disease recall their tick bite. And so again, that's going to be what tick can feed on you. It's going to be the nymphs that can feed on you and not find them. So again, Lyme disease comes from the ticks you don't find. I put this slide up because I think this is important. I said before that they feed behind your ear and in your scalp very often. And a lot of times, and I've seen so many rashes where all that we see is the edge of a little redness coming out of the scalp. And if you pull the hair back, there's an entire halo. So if you look at this little girl, um, she has, you can see this here, and this is probably a ring I would imagine probably started behind her ear. And the symptoms of early Lyme disease, you're not very sick. You hardly notice. And she looks like she's probably smiling right there. So you can get some generalized malaise. You might have a low-grade fever. You might be a little achy, but if you didn't find the rash, you're not going to suspect that you have anything significant. There's almost no respiratory or intestinal symptoms. And again, most of it is going to come from the ticks you don't find. If you didn't find the rash and it goes on to disseminate, you're going to come to what's called the early disseminated phase. And in this case, you've got a lot more bacteria in you. And so you start feeling a lot sicker. This is the most common presentation, is that it's gone through the bloodstream and landed in many different parts of the skin and created many different rashes there. The most I ever counted on a kid was 24 of them. Second most common thing for the early disseminated phase, and this has come up. So the initial tick bite, the early Lyme disease is usually anywhere from about 1 to 2 weeks after the bite. If you didn't find it and it goes on to disseminate, it's now about 4 to 6 weeks after the bite. And it can actually be even months after the bite. The second most common spot to be involved is the nervous system. And the most common thing we're going to see there is called Bell's palsy. So we all have 12 sets of nerves that come out of our skull, and they control different movements, different things. The optic nerve you see with, the acoustic nerve you hear with. The facial nerve is one that controls the movements of the facial muscles. And so this girl has what's called Bell's palsy. And in this first picture, picture A, she's trying to close her eye and she can't. Picture B, she's trying to smile and only one side goes up. So the left side of her face is paralyzed here. And in picture C, she's trying to do both. And you can see she just doesn't have any movement of that. 1% to maybe 2% will develop meningitis with an inflammation around the brain. This presents with a fever, stiff neck, severe headache. Now, Lyme meningitis compared to other forms of bacterial meningitis is not as severe of a disease. Our other ones that we vaccinate against will kill you within 1 or 2 days. Lyme disease can give you a much more prolonged kind of drawn out infection. It can also just affect the nerves that sense pain. So you can get pain because the nerve is being stimulated. And even in the early disseminated phase, brain fog, trouble concentrating can happen. I put this one up because one of the most interesting cases I ever saw was a 16-year-old boy who played the clarinet in his high school band. And in June, they were rehearsing for graduation, and he kept messing up because every time he tried to tongue the note on his clarinet, his tongue went off to the side. What he had was Lyme disease involving the nerve that controls the movement of the tongue. One of the rare complications involves the heart. And typically there, what it does is it involves the electrical conduction of the heart, and it can cause arrhythmias. Most of these probably go undetected and may get treated when we're treating other aspects of Lyme disease, but you can feel fatigued from the arrhythmias. But there's not a lot of other symptom. You may feel some palpitations. Rarely, it can be fatal. Late Lyme disease. So if we didn't see it in that early disseminated phase, which again, like I said, is typically about a month and a half to 2 months after the bite, very long afterwards, and this can be months and months. I've typically seen these happen in the winter. We can get late Lyme disease. The most common spot there is the knee. And this is really what they look like. They're not very painful. You don't have much symptom of illness at the time. Most of the ones that I've seen, the kids are playing basketball and they come in because they can't bend their knee very well because it's swollen like a grapefruit. Um, Anyway, but probably more concerning, late Lyme, if the Lyme disease wasn't diagnosed and treated in its earlier phases, you can get neurologic symptoms from that. Some pain, or some numbness, tingling, the facial palsy that we talked about before, headaches, fatigue. But really, the most concerning thing here is the kind of cognitive impairment, some memory loss, confusion, difficulty concentrating. And so that brings us to one of the most concerning things, and probably one of the least understood, which is what's termed medically is post-Lyme disease treatment syndrome, post-treatment Lyme disease syndrome. Commonly, people will refer to it as chronic Lyme disease. And somewhere about 5%, this is the CDC's numbers, 5% will experience pain even after being treated. Some pain, fatigue, difficulty thinking and concentrating. The definition of this is that it goes on for more than 6 months afterwards. Now, the long-term course of this, many people, it kind of gradually improves, but there are a number of people where this goes on and on. Um, it does not appear to be driven by active infection. There's always discussion, and there may be some bacteria that have survived, but multiple studies have shown that we don't get any sustained improvement when we try treating with antibiotics. Um, and I think that there's probably parallels with this with other things, that this is a post-infectious inflammatory disease where you have what we call an immune dysregulation. You're producing inflammation, and the inflammation that you're producing actually creates the symptoms. I think there's parallels with long COVID or chronic fatigue syndrome. How do we diagnose it? Most of the time, we're going to diagnose it by seeing the rash. And I'm going to criticize my own slides here and the slides you always see. We show these pretty pictures of rashes in wide open spaces like this, but I told you most of them want to be hiding in armpits and in the scalp. I want to go through some of the confusion about testing. So testing for Lyme disease is very difficult in the early stages. In fact, it's almost impossible. We can't culture it. It's not like a strep throat where you can find the bacteria on a swab. Um, Most of the testing is done by looking for antibodies against the tick. So here's where I want to bring you to a higher level of understanding. And that is, we're going to go through a little immunology. When you get an infection, you start off with something called your innate immune system. It's very non-specific. It just attacks anything that it considers to be non-self. But then we try to produce antibodies that are going to be specific to that disease, and so we can learn how to fight that disease in the future. So when you first get the infection, you have a little lag period and then start to produce a certain kind of an antibody called an IgM antibody. And it comes up within about a week or so of when it's starting to be produced. And then it starts to diminish as we produce our permanent antibody called the IgG antibody. Now, the IgG antibody is what we're testing for when we're looking at a Lyme test. You hear about a Lyme titer, you're looking at the titer of that antibody. It does not reach detectable levels until sometimes 4 to 6 weeks after the infection begins. And so it's not useful in testing in the very beginning of when you're first infected. So there is no test that will really show up the early infection. It's really diagnosed by the symptoms and mainly by the rash. So again, to get the significant amount of antibodies takes 4 to 6 weeks. That's actually well into the early disseminated Lyme time period. By late disease, we see a lot of antibody against it. So whether you have the late neurologic Lyme or the arthritis, we're going to have very high levels. Many of you have had or will have Lyme testing done somewhere in the future. If you look on your portal and you want to see what it looks like, I'm going to explain where some of the confusion comes in. And that is that we do what's called a two-tiered test. The first test looks for just the total amount of antibody that can react in any way against Lyme disease. So it's going to give us a quantitative number. Above a certain threshold, we're going to call that positive. But why does anybody, if they've never had Lyme disease, have any antibody in the first place? Well, this is a bacteria that's related to many other spirochetes. We have normal spirochetes living in our mouths. Actually, they're more closely related to syphilis. Um, but they have similar kinds of antigens, things that will react with the antibodies of Lyme disease. And so all of us will have some of that that's there. So if there's a sufficient amount of the antibody, we'll call the first tier of test positive. And this is where people get confused. That does not mean that you have Lyme disease. It means there's enough antibody to go on and test beyond that to look how much specific antibody have you made specifically against Lyme antigens. Classically, we've used something called a Western blot test. So many of you have probably heard of a Western blot. And what we're looking at, this is a positive Western blot. How many different specific antibodies has it made? The threshold there is that if there's at least 4, then the likelihood is that it's Lyme disease. Now, the Western blot is being eliminated in a lot of labs. A lot of labs go to a second ELISA test as the 2-tier testing, looking at specific antibodies for that. So you may not see this, but I think it's important to understand it. But the initial test showing just the initial ELISA being positive does not necessarily mean that you have Lyme disease. The other limitation of testing is reinfection. Once you've had it once, your antibodies are going to be positive and stay positive for a long, long time afterwards. So if we try to test after you've had it once, it may show up positive from your original test. So our hands are tied. We don't have a test for reinfection. Antibiotics, the earlier you treat, the more effective it's going to be, and the more you're going to prevent any long-term consequences. I'll list here doxycycline, amoxicillin, and cefuroxime are our main go-to oral antibiotics. If we treat in the early phase, 90% are symptom-free before you finish the infection. The others get better shortly afterwards. The late stage takes longer. Neurologic disease, we have to treat with doxycycline or IV medication in order to get it to penetrate into the brain. Amoxicillin won't penetrate the brain. And prophylaxis. If you have an engorged tick that you remove and you take 1 dose of doxycycline within 72 hours of removing the tick, you will prevent Lyme disease. And so I think that's an important thing for all of us to know when we take off a tick. If you can get the doxycycline and take it within that amount of time, you will prevent Lyme disease. So I keep a supply of it myself. I've given supplies of it to all of my friends and relatives so that they have it on hand for tick bites. But I want to move on because I think I'm running low on time. I want to talk about co-infections. In areas where we're seeing more anaplasmosis, they say up to 1 in 10 ticks, 1 in 10 of the times that you have Lyme disease, you're going to have a co-infection with anaplasmosis. So anaplasmosis has become more and more common recently. It was separated out. It's related to ehrlichiosis. It was reclassified in 2008, but you can see the amount of rise that we've had going on over the past several years. It's transmitted by the exact same ticks. Going back to 2011, this was something that was just very much isolated into the Mid-Hudson region. By 2017, moving all the way north and south along the New York State border and moving somewhat to the west there as well. And this just shows how much it has increased in what they consider the capital district, basically from the Mid-Hudson region all the way to the Canadian border, but how much more there is there. But we do see it lighting up more and more as we move farther west. When does it occur? And we're going to look at that same thing again. It occurs exactly at the timing of the deer tick nymphs. And why is it that this isn't shifted as far over to the right as Lyme disease? The transmission, the incubation period for anaplasmosis is only 5 to 7 days. The tick only needs to be on you for about 12 to 24 hours. It doesn't need to stay on as long as Lyme. And the symptoms are unmistakable. you are very sick when you get anaplasmosis. So you come up fever, chills, body aches, terrible headaches, come on very, very rapidly. Now, I'm going to take issue here with when people always hear that you got flu-like illnesses. Um, Flu is primarily a respiratory disease. It comes in through your respiratory tract. You're going to have some runny nose, sore throat, and cough. You will then be sick. You'll get systemic symptoms. These diseases come in through your skin and they go into your bloodstream. They don't give you respiratory symptoms. So if you have fever, chills, body aches with no respiratory symptoms in May, June, and July, and you're out feeding ticks, there's a very strong chance that you have anaplasmosis. So anaplasmosis lives within certain kinds of white blood cells. And so it's going to be circulating through the blood. Because of that, we can detect it in the blood through a test called the PCR test, but it's rare to have that one done. It's more going to be diagnosed by the symptoms. The other thing is it responds very, very, very quickly to doxycycline. I had anaplasmosis in 2018. I had taken a hike on a Sunday. By Friday morning, I started thinking I was sick. By lunchtime, I almost passed out at work. I was the sickest I'd ever been in my life. I treated myself by that afternoon, and I was fine by Sunday. Testing for it, again, it's just having the high index of suspicion. If you have these symptoms at that time of year, you're going to go with the presumptive diagnosis. Now, an important point, very many, if not most medical providers will not have much familiarity with this. If they've trained in a place that doesn't have anaplasmosis, they won't know much about it. So this is one thing where I want you to really advocate for yourself. If you're out there feeding ticks and you get these symptoms and you're that sick at that time of year, seeking medical care, but even telling the provider, listen, I think I could have anaplasmosis. You can even lie to them, say, listen, I removed like 5 ticks last week. I think I have this. But get yourself doxycycline and you get better a lot quicker. I think I'm running low on time. I'm going to skip babesiosis for right now because I want to get into prevention. So prevention, I think awareness of your environment and season, the things that we've gone through here right now, being hypervigilant in May through July, wearing light-colored clothing, tuck your pants into your socks, tuck your shirt into your pants so that as the tick climbs, it only has access to you at the top. You can put the clothes in the dryer for 10 minutes afterwards. Don't put them in the washer first because you're going to give the ticks the moisture that they love. You want to dry them out. And remember that most Lyme disease comes from the ticks you don't find. You check yourself for ticks. Check your clothing frequently while you're out. Check your entire body for ticks. Remember that in early Lyme disease, 80% had the rash. Only 25% remembered their tick. So tick checks are also rash checks. You're looking to see if you have that round ring. And one little key that I'm going to give you is red rashes come out when your skin is warm. Check yourself after the shower when your skin is warmed up from the shower. Repellents, permethrin, which you can get, I get it from REI, sprayed on the clothing is very effective in repelling ticks. If you spray it on the clothing, this can last for 6 weeks or up to 6 washings. You can also buy clothing that says it will be good for 70 washings as well. Putting repellent on your skin works. DEET, picaridin, and IR3535 are the ones that you should use. Oil of lemon eucalyptus has a strong odor and it only lasts for about an hour, but they are effective in repelling ticks as well. The removal of ticks, we always see the same kinds of pictures that what you want to do, you don't want to do anything that's going to make the tick secrete saliva into you. So the old thing of burning them with a match or smothering them with any kind of anything you're going to put on them topically is going to make them secrete that saliva. You want to grab them as close to the skin as you can and just pull them out. Now, over here, I've written when you've pulled it out, if that tick's been on for a while, some of the mouth parts are going to be left behind. Some of the head is going to be left behind. The cement is left behind. You'll get a local reaction to that. You can get a bump that may be the size of a quarter or so. That's not Lyme disease. That's just your body's reaction to it. Very briefly, vaccines. There are two vaccines in development right now. There was a vaccine in the 90s. I took it back then. There was concern about arthritis from it, and the target population was there was so little Lyme disease there that they just pulled it from the market. So the take-home points, be aware of the season and the environment. Think of the activities that you're doing at certain times of year. Wear your pants tucked in, like I said before, hike in the middle of the trail. And again, the take-home points, most of this is going to be May, June, and July. It's transmitted by the nymphs. Tick checks are rash checks. And if you have all of these more severe things, body aches, fever, brain fog, at that time of year, feeling very sick, advocate for yourself, seek medical attention, and try to get yourself treated. I'm going to end with a case. So I retired in October last year, and on October 6th, we had a retirement party. Right as one of the speakers was saying, yeah, but we're still going to call you for tick bites, one of our nurse practitioners looked down. This was her 6-week-old baby, and here is a deer tick nymph behind the baby's ear. Here he was 10 days later. So how does a 6-week-old baby get Lyme disease from a deer tick nymph in October? His dad had been clearing Japanese barberry from his property. And here he was 3 days on antibiotics. This was, his mother said, his first actual full-on grin of his life. And he lived happily ever after. So I know I took up all of my time. And if there's any time for Christy, I don't know if we can go on with any time for questions. I'd love to answer questions.
Yes, thanks, Dave. Thanks for all that great information. We can take questions, and if people, can stay on, they're welcome to stay on. And if they have to go, they can go. But we do have some questions in the chat box. So I will read those to you. Somebody did ask if there was hope for a vaccine in the near future. And I know
So
you
those,
covered that, but I'm wondering, there are a lot more people who might want it now than in the past. Is that
so I skimmed over that quickly because I knew I was out of time. The two vaccines that are in development right now are expected within the next couple of years. And yes, I think that there will be a lot more people. When it came out the first time, it was during a wave of vaccine skepticism at that time. And so it was hardly worth it. There just wasn't enough of it. So they just pulled it from the market. They didn't want to deal with the expenses of all that.
Thank you. And then Peggy asks, is climate change affecting the timing of the tick life cycle? I've noticed personally that when I'm cleaning up my gardens in the spring, raking out the leaves, I find more nymphs on my skin in April than any other time of the year.
So I think so. I am not a tick expert, but I've kind of, again, I've been interested in Lyme because I've been in one of the most endemic areas for 40 years. And so I've kind of tracked it as I started learning about the nymphs. When is the first nymph that's reported to me by parents? When is the first one that they find? And it always used to be mid-May. And every year since then, it's just cycling earlier and earlier. Now, that's not scientific necessarily. I'm a believer in the statement that the plural of anecdote is not data. But anecdotally, I can say that we've been seeing them earlier and earlier.
Shane Holmes says, hi, Dave. Thank you for a wonderful presentation. Are you seeing a rise in Lyme disease infections with global warming, or is it the opposite since they don't like drier, warmer climates? but seek moisture?
I don't know. Again, the moisture thing is an important thing. And I was at Carey Institute on Saturday, and I asked one of their, I was on one of the hikes there, asked one of their people what they're thinking about with the like I said, we had record-setting drought in the fall when the adults should have been feeding. And he was not one of the tick scientists there, he said, but he said they are reporting a robust number of adult ticks. And so even with historic levels of drought that we had then, the ticks seem to have survived. And so once they do get a hold of that moisture, they're, it appears. And I'm just very curious to see what's going to happen this spring. Are we going to have a bumper crop of adult ticks? Again, I'm not very worried about adult ticks in terms of Lyme disease. You're going to find them, you're going to remove them. But anaplasmosis, maybe the tick only needs to be on you for 12 hours to 24 hours. So, finding them and removing them is the important thing. It's the nymphs that are going to be the problem.
Mary Ann Bald asks, are there any negative consequences to dosing with doxycycline if you don't actually have Lyme or anaplasmosis?
So, there's no greater downside than the downside of treatment when it's proper treatment. So anytime you're going to take an antibiotic, you're going to disrupt your microbiome. Longer treatments and more frequent treatments, you're going to expose the other bacteria in your system to those antibiotics and create other resistant bacteria in your own system. And so you don't like to take them a lot. However, if you are a naturalist who is out in May, June, and July, who shows up with those symptoms at that time, taking the antibiotic is just, it's the greater good. It adds up that it's worth doing. Now, the same thing when you're out of the nymph season, probably no. So if somebody, for example, if somebody's going to show up with Bell's palsy in February, and they didn't have Lyme disease, I'm not going to treat them with antibiotics. The Bell's palsy shows up, maybe a month to a month and a half after the tick bite. You're not going to see that at that time of year. One of the things, and I kind of went through this briefly, but when there has been the concern of chronic Lyme disease, so there had been a tendency to treat with long-term antibiotics for people who had symptoms that went on beyond beyond the infection. And there are still some people who do treat that. What's been found is, and there were 5 different studies that were placebo-controlled studies that showed no lasting improvement being on the antibiotic. Sometimes you get an initial improvement in your symptoms because the antibiotic itself can have an anti-inflammatory effect. So you feel as though the antibiotic is making you better. But those long-term antibiotics actually can run into much more serious kinds of problems, more serious than the short-term antibiotics. And so it is discouraged.
Thank you. That I have a question for you, and that is you recommended the prophylactic dose of doxy if you know that you've been bitten, but it's not recommended by CDC, is it? And I mean, my doctor's office has told me that, and my primary care physician himself will give me a prophylactic dose if I can reach him, but his office will often prevent that from happening.
So so you're hitting I'm going to expand on that a little bit. Prophylaxis tends to be a dirty word in medicine. Um, and so the knee-jerk response for people who have not dealt very often with these diseases, the knee-jerk response is that is prophylaxis should not be given. Um, when you're in an area where there is a lot of Lyme disease, prophylaxis can really prevent going on to longer term things. So when you go to, I've attended many, many medical conferences along the way, infectious disease conferences where there will be speakers on Lyme disease. And as this has come along, I can tell you that the infectious disease people who really study this, they say, hey, this is a no-brainer. one dose of an antibiotic to prevent an infection that can cause long-term problems, do it. So I have no reservation in doing it. People who deal a lot with Lyme disease and tick bites have no reservation in doing it. And get yourself a stash. Again, for my family, my friends, I make sure that everybody has a fresh stash of doxycycline in case we're going to need it.
Mhm.
Um, and I know that that's something that I'm saying kind of as a joke, but hopefully, I know that you're in the Finger Lakes area where there is an increasing amount of Lyme disease, but you haven't dealt with. We've dealt with it for 40 years as an endemic kind of a thing. The providers there are not going to be as aware of these kinds of things.
Mhm.
It's not a bad idea. When I said before, really advocate for yourself. Say that I really know that I have a high risk of this disease right now. I know. So when you go to seek medical care, an urgent care, or an ER, or your primary, often they're going to send something called a tick panel. They're going to send um, testing that's going to look for antibodies against Lyme disease, anaplasmosis, and babesiosis. Um, well, I just showed you that those aren't going to be positive until 4 to 6 weeks after the actual tick bite or the infection. And so testing, so they all often say, I'm going to send a tick panel, and if it's positive, we'll put you on medicine. Well, it's not going to be positive until the disease is spread through your body. And so you may need to be one of those know-it-all patients who says, I really have heard that, that isn't going to show, and my symptoms are very consistent. Again, let me point out in a little more detail. There are no illnesses that commonly affect adults in May, June, and July with sudden onset with fever, body aches, and chills with no respiratory symptom. So if you've got that and you've been out feeding ticks, your likelihood that you have a tick-borne illness is great. And your likelihood that if you treat with doxycycline at that time, that you're going to just eliminate long-term problems, yeah, it should be done.
What is a single dose? What do you consider a
So a
single
single dose is actually a double dose. It's
So two
200
pills?
milligrams. Normally, it's 100 milligrams twice a day. Now, anaplasmosis can be treated just 5 to 7 days will treat anaplasmosis. Lyme disease, you need 10 days. When I've treated people with suspected anaplasmosis, I always treat for 10 days because I assume that they have Lyme disease that I'm knocking out of their system before it can be diagnosed. So I'll always go for the longer treatment. Now, doxycycline is a pain in the butt kind of a medicine because it sensitizes you to the sun. So when you're on doxycycline, you can fry in the sunshine. I've had two kids who went on doxycycline and went on beach vacations with no protection at all. Two kids who sloughed all 20 of their nails as a toxic reaction from the doxycycline in the sun. So, if you're on doxycycline, wearing sunscreen, covering your skin, wearing a hat.
Mhm. So the
It's like a bad joke,
prophylactic
though. It
dose?
happens exactly when you want to be outside. The
Yes, right.
prophylactic dose, yeah, maybe for that one day, you're going to want to protect yourself.
Okay, so that's just one day taking one pill or two pills?
Two pills
Two pills
once,
once. Okay,
and it
got
has an 87% success rate.
it. Okay.
And so it is a very good treatment. So that is with engorged ticks. Non-engorged ticks won't give you Lyme disease. But how do you tell? If you found a nymph, can you really tell? Those things are so tiny. So any nymph, I'd be perfectly fine to treat it. An adult tick that still is kind of reddish brown and small, no, you don't need to be treated. It hasn't engorged yet. But once it's actually even changing color, you might as well assume that that's enough. It's fed long enough to warrant treatment.
Mhm. Okay. Paul asks, or says, when I had Lyme disease last year, my tests were done by a PA in an urgent care facility. I was frustrated to realize that he didn't understand how to interpret the test results as well as I understood them, which I learned from reading reputable information on the web. The information is confusing to understand, and the non-specificity of the tests makes it all even more confusing. I had to convince the doctor to give me the second test. Why don't they use the second round of tests more frequently?
Normally, it should when the test is sent. If the first test shows sufficient antibody to even go on, if you don't have sufficient amount of antibody, it's not going to kick into the second test because you just don't even have enough antibody to test. So if you're being tested in the early phase, and I realized that I was getting late on time when I went through that part. Um, do you mind if I share again? So I went through that probably faster than I intended to. And this is when I said I want to bring you to a higher level of understanding. This is really what I wanted you to understand. And so the first test just looks quantitatively. Do you have enough antibody that it even is worth testing? And that kicks it to the second test that's going to look how many specific types of antibodies did you make? This is just gross total number. This is specific types of antibody that you're making. But these things don't show up until 4 to 6 weeks. And then as the weeks pass beyond, then we'll see more and more and more of them showing up. So testing at the time that you're showing up with the acute symptoms of Lyme disease is not going to tell you very much. It's likely to be negative. It's likely not to kick over to the second level of testing because you haven't produced enough of the antibody yet to even go to that level. And that's why I'm really saying you really, and I don't mean to be doctor bashing or in this case, PA bashing. If they haven't dealt with a lot of Lyme disease and then anaplasmosis, which has been in a very localized area, none of them are going to be very familiar with some of these things that we're talking about right now. And that's why I said you may sometimes need to be that obnoxious patient who's going to advocate for yourself by saying, listen, I really, this time of year, I have these symptoms. I know that early treatment is worthwhile. I know that the testing may not show in the early phases. Please, please, please treat me and then go find somebody else to treat you.
Right, thank you. Joellen had her hand raised. Joellen, do you want to unmute?
I'm going to be intimidated by Joellen asking any questions because
Well,
she knows so much more about ticks than
not
I
at
do.
all, Dave. I really, really appreciate this because my job ends with what to tell your doctor. So I really appreciate this information. But this is actually a question for you, Christy, because I teach a lot of master gardeners and I tell them this is where you stop. You stop with what you they can tell their doctors, and we don't get into symptoms or treatment or diagnosis. And I'm wondering, as master naturalists, whether there's a limit as to how far we can go when we are educating people.
Oh, I guess after tonight, I would recommend that you just give them the YouTube link to Dave's Naturalist Exchange presentation.
I'd be glad to talk to anybody as well. My email is out there. So I'd be glad, if anybody contacted me to speak about this.
That's great. So the recommendation is that we're sending them on to the experts.
To the experts, yes.
And Peter has a hand up.
Was it Peter?
And
Okay.
you muted. Peter,
How I just if you come back from a hike and you want to just and things you haven't had the time, say maybe to embed in you, how reliable is the water pressure from a shower washing stuff off your body that hasn't yet embedded? Should you
so
not?
not embedded, that can help. You really scrubbing yourself, washing yourself well, and then checking yourself when, in Joellen's talk, I believe she actually talks about it. It's like, hey, you're in the shower. Here we go. You soaped yourself up. Take a look. My addition to that is, and in Joellen's talk, she does make another important point, and that is ticks are going to be on you for several days. So it's not just that you're checking today for today's ticks. You're checking for the ticks that you might have gotten over the past few days. And it's almost as though as those ticks are enlarging and engorging, it's like, okay, we'll give you more hints. Can you find it if it's this big? If it's an apple seed, can you find it if it's a blueberry? Um, so you're checking for that. But the point that I wanted to add into this is only 25% of the ones who were diagnosed found the tick. It's the rash that we diagnose with. And red rashes come out when your skin is warm. And so, there are a number of things as a pediatrician, fifth disease, rashes that are very, very faint. You put the kid in the hot bath and you pull them out and you see the rash. Um, so the rash can be very, very subtle to be able to find. And looking for it that way, I think is important. But yes, you can get them off of you before they've really embedded. When they're first embedding, they come out very, very easily. And at that point, you don't need prophylaxis for a tick, that you just got it and it just popped right out. Once they're deeply embedded, again, their entire front end is in you and it's cemented in you. They're going to be harder to pop out. So if they pop right out of there very easily, they're either fully fed and ready to detach, but at that point they're going to be engorged, or they really haven't embedded enough to start taking a blood meal, and you're not in any risk then.
Thank you.
Thank you. Joelle, and just to get back to your question, I mean, I'd say that it's okay for us to give people information on prevention and steps that they can take to prevent. But beyond that, it's probably best to have them consult their physician, or in this case, maybe watch Dave's video, this recording, because he is a physician who has a great deal of experience with tick-borne illnesses, and then see their physician. Or both.
Right.
Do both.
But as he mentioned, so many doctors are unfamiliar. So I'm
Yeah.
going to just double down on what you were saying about you being an advocate for yourself.
Mhm.
And I also love that term. If you're out there feeding ticks, I hadn't heard that
Yes.
before. I might
And,
steal that.
I think one of the things that's going to be important, and this is just a Gestalt thing of mine, as this moves into new areas, and so we've been dealing with this for 40 years where we are. As it moves into new areas, I think people are less and less aware of it. Yes, the Finger Lakes are starting to get some right now, but a lot of people won't be aware of it. And I think that even as the patient themselves are not as aware to be looking for all this. So I think we tend to see later stage disease than we do in the highly endemic areas like Dutchess County, where we just think about Lyme disease all the time. But if you're in an area where they don't, I think, just anecdotally, when I hear many people say, that I got Lyme disease, I didn't know I had a bite. I wasn't diagnosed until way down the road. I think if you're in an area that does not have a lot of Lyme disease or a lot of familiarity, both the patient and the medical system are not going to know.
Okay. Thank you so much, Dave. This was timely information and important information for all of us who spend a lot of time outdoors.